Our last speaker for this session is Becky Platt. And I've known Becky online for some time now, but we met face to face about 3 days ago, which is kind of how this thing goes. Becky is a senior advanced care practitioner at the Royal London Hospital. She is a wonderful person and an amazing nurse. And she's going to share with us her experience of connection through conflict. Here's Becky Platt.
I'm walking towards the Ukraine border. Behind me, there's a row of tents accepting refugees into Poland. There are tables with urns of hot drinks. There are supplies of warm clothes. There's baby food and nappies. There's a steady stream of refugees walking towards me, but I'm walking the other way. As I walk through the high fences topped with barbed wire, it all starts to feel very real. In the last few weeks, I've been in a constant state of anxiety and turmoil about whether I'm about to be deployed. Like many people, I've been glued to the news, watching this humanitarian crisis unfold. I've been desperate to be able to do something to help, just wanting to make some sort of difference. But I'm one of the lucky ones. I've got the training and the skills to be able to help in this situation. So as the gap closes between me and the border, I think of my family. Me coming here is a big ask of them. I'm asking them to accept me putting myself in harm's way. Despite the training, I know that many of my friends think I'm being irresponsible, stupid even. But the people who know me the best said, "Go. This is what you do." But for now, those experiences have to be put to one side. Those feelings are not for right now. Because there are other emotions there too. And if I'm honest, excitement is one of them. This great sense of adventure. I'm here to be useful. I'm going to make a difference. 3 days later, I've never felt less useful. Not only are we seeing far fewer numbers of children than we expected, but the adults we're seeing have got significant chronic healthcare needs. And actually, if you're a 65-year-old with COPD, you really don't need me looking after you. It turns out that not all respiratory illness is bronchiolitis. Many of the families who've been displaced from their homes elsewhere in Ukraine, and there are tens of thousands of internally displaced people in Ukraine. Many of those are now living in places like university halls of residence, school classrooms. And I visit one family in a school classroom. This classroom is what they now call home. There are a few mattresses on the floor, a couple of bags with their belongings in. Mum and Grandma are hovering anxiously over a small child in a travel cart. She's very obviously got significant medical needs. She's blind. She's got cerebral palsy. She's gastrostomy fed. She's got an unsafe swallow. But at the moment, her gastrostomy is not working. It's been blocked since they left Kiev and she can't feed through it. Mum is desperately trying to encourage her to take a few sips of water from a cup. In the corner, her grandfather stands like some sort of spectre. He's there, but he's not there. Whatever he's seen has broken him, and he is unable to communicate with the world. The psychological trauma that we are hearing about from these families is palpable. We've heard stories of families who've been trapped in basements for weeks, people who've been drinking snow to survive, stories of homes decimated, relatives shot, futures destroyed. And he is one of those people. I need to fix something here. So I use my problem-solving skills and Google Translate, and I get hold of some pineapple juice and some fizzy water, and I use it to unblock the gastrostomy. Now she can feed again. But I leave with a heavy heart. It's not enough. There's so much distress, so much sadness in that room, and I've barely scratched the surface. But this isn't a problem unique to Ukraine. How many times have you been desperate to help a child or a family, and it just feels like there's nothing you can do? The whole system is against you. Things are completely out of your control. The problems are just too big. But do our patients actually need us to fix everything? Even anything? Well, if you look at research from organisations like the King's Fund and the Point of Care Foundation, they spend a lot of time looking at humanity in healthcare and what patients and families perceive to be quality in healthcare. And actually, the fixing is not the thing that matters. What patients actually remember is the emotional connection, the small acts of kindness. Those are the things that matter. Let's remember the work of the wonderful Kate Granger. You'll remember her as the doctor who started the Hello, My Name Is movement. She recognised that the clinicians, the nurses, the doctors, and the whole team looking after her, she needed a connection with them. It wasn't that they needed to cure her. That was never going to happen for her. But she needed the connection. There's also a quote that I love from Patch Adams. When you treat the condition, sometimes you win, sometimes you lose. But when you treat the patient, you win every time. And I think of the times in my career that I found the most rewarding, the things that stay with me and that make me able to do this. I've been doing this for a quarter of a century. These are the times that matter. And I remember one time in particular, sitting with the mother of a 7-year-old boy who I've known for a long time. A boy with complex needs, with Down syndrome, with a cardiac condition, with a seizure disorder, with recurrent chest infections. A child who's been to intensive care more times than I can count. A child who I've never seen well, who I don't really think I've ever seen make purposeful movement. And I sit down with her, and my goal is for her and me to come to an agreement about what his end-of-life plan will look like. What are we going to do at the end? And she stops me, and she says, a month ago, he smiled for the first time. I can't begin to think about the end until I see him smile again. Those were her ambitions for her child, her hopes and dreams. They may be different to the ambitions and the hopes that I have for my children, or the dreams that you have for yours. but it doesn't make them any less valid. I think we all have some children that we hold in our hearts, and he's one that I hold in mine. And the reason for that is that they gave me an insight into their life, a connection that I will never forget, a gift of an insight into what it meant to walk a mile in their shoes. We see our patients in a snapshot moment, but they have a whole life behind them before we met them that didn't involve us at all. We see one tiny piece of the jigsaw. And what we need to do sometimes is to stand back and see the whole picture, see where that piece fits, and try to understand that bit. Those are the patient stories that shape us. Those are the moments that connect us to our patients and that make meaning out of what we do. I love those patient stories. That's what makes my job worthwhile for me. And I believe strongly that we are in a privileged position to be there in the moments that shape people's lives. And it's all about the connection. And if we think about connection a bit more, let's think about the work of the Schwartz Round movement. So Ken Schwartz was a terminally ill man who recognized that not only are patients touched and shaped and changed by the clinicians who care for them, but we are also touched and shaped by their connection with us. And sometimes that connection just lasts a tiny moment, and sometimes it lasts over the space of years. Ken Schwartz recognized that there was an emotional cost associated with that for us. And he wanted, through Schwartz Rounds, to give us the time and the space to acknowledge that, to reflect on it, and to make meaning of it. He said that he wanted to make the unbearable bearable. If we look at the research that comes out of Schwartz Rounds and that community, it's very clear that the clinicians who are able to connect with patients, to see them in context, to see that big picture, and to acknowledge and reflect on the emotional aspect of that, are not only able to provide better, more compassionate care for their patients, but also better able to stay psychologically safe and to care for themselves and other clinicians around them. So let's remember to think about those stories. Think about the big picture. Maybe next time you're at work, just take a moment with one of your patients and find out, what's the whole jigsaw for them? Who are they before they met you? Maybe you'll see a patient that's someone that we all find less easy to connect with. Maybe a young man comes in under the influence of drugs and alcohol again. He's difficult, he's combative, he's rude, he's offensive, he's just generally unpleasant to be with. Let's all try to look beyond that. Let's see the scared boy, the vulnerable child who's got himself in too deep and doesn't know how to come back from it. Let's tell him he's safe. Let's be there for him. What about the mums that we see with the completely well babies? The ones where, honestly, at 2 o'clock in the morning, it could be easy to roll your eyes about. But let's take a moment with those mums. These are some of my favourite patients. Let's look beyond the incompetence of first-time parenthood and recognise the exhausted mother who is just completely bowled over by having a human life completely dependent on her. Let's take a moment, give her a break, make her a cup of tea, tell her she's doing a good job. By the way, as a Brit, I can tell you quite categorically that there are very few situations that cannot be improved with a cup of tea. I know from first-hand connection, first-hand experience, how important these connections are and how important the context is. A few years ago, I'm a cancer patient. I've been admitted to hospital overnight, and I'm lying in bed in the morning. I've been rehydrated after my chemotherapy. I've been awake all night, grappling with two problems. One, how do I survive cancer? And two, how do I prepare my 5-year-old twins, Eden and Noah, for a life without me if I don't? My oncologist, Dr. Shah, comes in the morning, and he entirely ignores those two problems. He says to me, "What do you need today?" And I say, "Okay, my kids have got their first assembly this afternoon. I need to be at that assembly. I've got to be upright for an hour, and I can't vomit for the whole of that time." He properly rises to that challenge. He gives me every antiemetic known to man. He hooks me up to a subcutaneous infusion, and he gives me illegally a syringe driver that I can hide in my handbag. I make it to school, and I'm upright as the kids walk onto the stage. They scan the audience looking for me, and as their eyes meet mine, I see the relief on their faces. And I know that that was all I needed to achieve today. Dr. Shah didn't treat my cancer that day. He treated me. He did a total Patch Adams on me. I go out to the playground to meet the kids at the end of the day, and I'm thrilled to bits to have been there. I'm super proud of them. It's a big moment. Get a bit tearful, well up, make a bit of a spectacle of myself in the playground. And my daughter looks up at me and she says, "Mummy, you are so embarrassing." And I think, yes, my work is done. I don't remember him as the doctor who cured my cancer. I remember him as the doctor who got me to assembly. So, let's just take a moment to check in with the family in Ukraine. You'll remember the family living in the classroom and the child with the gastrostomy. I check in on them a couple of days later, and as I enter the room, the mum and the grandma come over to me and they just grasp my hands tightly. "You came back," they say. "You stayed." Maybe just being there was enough. Maybe you didn't need to treat the blast injuries and the massive disease outbreaks. Maybe just showing up was enough. I went to Ukraine to make a difference. It turns out I did. It wasn't the difference that I was expecting to make, but it was the difference that they needed. We did what we could in that moment, and what we did made a difference. It took me a while to make peace with that. So, in those moments when you feel nothing you can do will make a difference, stop. Remember, the small things make a big difference. To paraphrase Patch Adams, when you treat the patient, you win every time. Thank you.